Well, this morning's video is about MaineCare and its current condition. My Lord. There was a story on the Maine Wire. The editor-in-chief there, Steve Robinson, he has this Robinson Report, it's called. And the article that he wrote was just describing this one situation that MaineCare has, and there's multiple situations just like this, and it makes no sense at all with how well, as you know, down there in Augusta, it's the Democrat Party that has all the power. Whenever money is distributed to whatever they want it distributed to, it's the Democrats that have the power, right? And not only do they have the power to distribute the money, but they also determine the amounts and where it goes and who gets it and who don't get it. And the way they've got it set up here, if I'm understanding what Robinson's report was, like I said, this is just one of the scenarios. There are many more, but this is just one. They put this money towards hospitals here in Maine so that people can get their health care, okay? Now, on its surface, that's what it appears. When they're standing down there in the Maine legislature, they basically say, well, Mainers need to have their health care. Mainers, people who live in Maine and are tax-paying Mainers. And hospitals need to be subsidized by the Maine government to keep the hospitals open and keep them going. And they make this sound like, yeah, that's what you want. We want to keep the hospitals going. We want to make sure that everybody gets the health care that they need when they need it. Okay? Like I said, on the surface, it sounds great. It sounds wonderful. But when you start getting into the nuts and bolts of how the Democrats have it set up and what they're doing, here is a for example. Let's just pretend for one moment that in the state of Maine, there are 5 hospitals. And each one of the hospitals get from the state $1,000. So, every year, the state of Maine, via the Democrats' policies that they've put in place, gives these hospitals $5,000. Each one of them get $1,000 a year for the 5 hospitals, and that's what they operate on. But then what happens is, in the state of Maine, all of a sudden you start getting illegals brought to Maine. And once these illegals get here, they all of a sudden start getting the same thing that Mainers are supposed to be getting. All of a sudden, they're able to get onto MaineCare. And each one of these hospitals who had just Mainers coming to their hospitals getting health care, well, now all of a sudden, each one of them hospitals have got 1,000 more people that are coming to get their services. But the government is only subsidizing each one of those hospitals with the $1,000. They've only got enough to take care of the Mainers, but all of these extra people that were allowed onto MaineCare now puts a burden on these hospitals to provide services that the hospitals aren't getting paid for to give to these people. Now, when I sit there and I look at that, that tells me that this whole healthcare idea that they set up was set up not to keep the hospitals open. Because how can a hospital operate? How can they operate when they're given enough money to take care of 5 people, but then all of a sudden 5,000 more people get onto this same program and then come to those hospitals. How do they do it? How do they do it? It doesn't make any sense, other than if the original plan and intention was to put the hospitals out of business. I mean, there is no other logical way to look at it. Other than that, I mean, why would the state of Maine say, well, okay, we're going to give each hospital just enough money to keep the doors open, but then we're going to take all kinds of people and allow them to go to that hospital and run a bill up that the hospitals can't even pay, let alone those patients coming in to get the treatment that they need. And that's irregardless of what the treatment is. It doesn't matter. This is exactly what happened back when Governor LePage was the governor. Or I should say, it's what happened way before he became governor. And when he became governor, he was really good at budgeting money. And he somehow managed to budget it so that the state, if I remember right, had something like $500 million in surplus. It was $500 million. I think that's what the number is. Don't quote me on it because I could be wrong, but it was a huge amount of money that the state had in surplus. And usually what the state of Maine would do would take that money and put it into what they call the rainy day fund, so that you've got money there in case something happens. You've got the money to cover the unexpected. Well, because at the time when LePage was in there, right at that very time, hospitals were in the same condition that they're in right now. They are literally in their death throes. They are right at the point of having to close their doors. I mean, they just closed a place here in Maine. It had something to do with women going in to have their babies. That's what this particular one was, helping women have their babies or something to that effect. And they had to close it because, again, the state was giving them so much money, just enough to keep the doors open, and that was it. But then all kinds of patients came in that had to get care, and the hospital couldn't keep operating because they didn't have enough money to keep going. And the next thing you know, they're closing the doors. Well, this is exactly what was happening when LePage was governor. So when he was able to budget and be able to set aside, I think it was $400 million or $500 million. And I don't know how many hospitals there were in the state at the time that was still open, but every one of them needed money. Every one of them not only needed money, but they needed all the money that they could get. So Governor LePage got right on the ball and made sure each one of those hospitals got paid so they could stay open and continue providing their medical services to people that were here in the state. And ever since then, once LePage left office, he finished his term and he couldn't run again. The state just picked right up where they left off, and they kept giving hospitals money, but nowhere near the amount that they needed, but kept on allowing people to get onto MaineCare. And then when they went to hospitals, as with hospitals anywhere, I think this is how it works. But I know any hospital that I've ever been in, when you're sitting there waiting to go to your appointment, there's always these signs on the wall that says, this is such and such hospital you're at today, and our prime directive is to take care of people. If you come through them front doors, we basically take care of you and worry about the money later, because your health, and that's a law. I think that's what all hospitals have to do. They can't turn someone away because of money. They have to take you in and take care of you, provide the service that you need to get back onto your feet. And the state of Maine takes advantage of that by allowing all kinds of people to get onto MaineCare, and then these people go to the hospital to get their, or the doctor's office, to get the care and whatever they need, and a bill is made. And then the state only gives that hospital a few dollars towards that bill. They don't pay the whole thing. They give them just enough. And now it's gotten to the point where they're not even giving them just enough. The majority of these hospitals are so in the red that it ain't funny. Probably, if you saw the books, you'd probably say, how in the hell do these hospitals even stay open? And no wonder people are getting out of the medical profession. And why would anyone want to get into it? And this is all because of Democrat policy. It makes no sense, but this is exactly how they think that our medical system should be operated. Craziest damn thing I've ever seen. Not give enough money to keep a hospital open, and then turn around and allow all kinds of people onto MaineCare that they can't even pay for. This is Democrat policy. If you vote for these two Democrats, if you vote for Troy Jackson, and if you vote for Hannah Pingree, this is what you're going to get. You're just going to get more and more hospital closings, nobody wanting to have anything to do with the hospital profession. And it has nothing to do whether they like or dislike hospitals. It has everything to do with the money. It's not being managed right. The whole system is not being managed right, and it's imploding on itself as every day passes. My advice is, do not vote for Hannah Pingree and do not vote for Troy Jackson. Susan Collins will get money from Washington and help pay to keep these hospitals open. Bobby Childs, I'm going to vote for him. And I know he's going to do everything he can. He's going to try to do just what LePage did. Get the hospitals paid and keep them open. And start putting limits on how many people that are not Mainers on to MaineCare. And go through the system and make sure that Mainers are being taken care of. It's Maine tax dollars that's paying for it, and it's Mainers that should be getting this health care. It can't be explained any clearer than that. It can't be. So please, when you go and vote, join me. I'm going to vote for Sue Collins, and I'm going to vote for Bobby Childs. These two are going to do what they can to make this mess, get it cleared up, and get it straight and right for the Maine people. I can't stress it. Vote for those two people. Vote for them. Do not vote for Troy Jackson. Do not vote for Hannah Pingree, because if you do, then expect more hospitals to be closing, and you will go and try to get your health care, and you won't be able to get it. You'll have to go to another state that's got better health care system in place. It's as simple as that. Okay, I thought that was a good one for today. I've gone a little longer. Well, I ain't doing too bad. I'm at about 14 minutes here. That's good. Today is Wednesday, August 5th, 2026. Looks like we got another good warm day coming, but that's okay. It's going to be clear. Let I come, I'll take it. Long, cold winter's coming, so I'm going to try to enjoy what good weather we got left. It's already August. Won't be long now. It'll be the first snow here. September, October, November. So we got a couple, 3 months here to go. Won't be long now. All right. Thank you for staying this long. I hope you enjoyed this morning's topic. I want to hear what you have to say. Leave a comment. And don't forget to like, subscribe, share this video with your friends. Let's all have a good conversation about this. Let's solve these problems. And we can do it by working together. Yes, we can. And like I said, don't forget, like, share, and subscribe. All right, go out and have yourself a great, wonderful Wednesday. We be gone.